Hello everyone, this is Dr. Alnemr, an infectious disease specialist here in Canton, Ohio. I would like to start by extending my thanks and appreciation to our people, to our healthcare workers, doctors, nurses, and everyone who's working at the hospital, from the administration to everyone there who has been working tirelessly to take care of our patients, COVID infected or not infected. I would like also to thank our people by doing their part. Thank you for staying at home, and thank you for keeping your social distancing promises and following our health department and governor's recommendations. We have accomplished a lot so far, but we still have a lot of work to do. Now we are expecting the surge in Ohio based on what happened in other states and other hot spots in the country. I would like to ask everyone not only to stay at home, but to stay in their state. It is very important at this point for all of us to play our role, transmitting and transferring infections and travel across the state line, especially from the hotspot areas. We're talking about New York City, Michigan, Louisiana, and other places, might increase the risk of deadly infections and suffering for our people and our patients in the state of Ohio. Might cry out to our people, our healthcare workers, and our governor, and I would also expand my request to our president to try to implement travel restriction across the state lines. Obviously, with the exception of our military and government and supply chain and medical and humanitarian travel, we should keep our distance. We should stay in our states. We should stay at home. Hopefully, we can curb the surge. This is my goal, and this is my dream. We can accomplish this with the help of everyone around us. We have done a lot of work, and this is my request to our governor to immediately establish restrictions on the travel to and from the great state of Ohio, at least for the next 2 to 4 weeks. We are expecting a surge. Our nurses and our doctors are preparing day and night, but we cannot contain that without restricting our travel across the state line. It has been such a great deal of anxiety and psychological pressure that this has placed on all of us, whether families are home and children learning from home, or nursing staff who have been putting hours in and out. You can't even imagine how stressful it is for that nurse spending 6-7 hours with every patient in these rooms, not knowing if they're going to transmit the infection to their family members. Trying to prioritize our care to all these patients with the limited resources sometimes. I've spoken to a lot of my friends in Cleveland and New York City. It has been such a stressful and a very morbid outcome. What's going on there is something I would like to avoid, or at least to minimize the damage from the surge. Obviously, it doesn't have to be that deadly. It doesn't have to be that sharp of a morbidity and a mortality surge in the state of Ohio. But again, I can't emphasize this enough. We have to restrict travel to our state. All the other states should do the same. It's all temporary measures until we are able to stop this domino effect that might be taking us all the way from New York City all the way to Los Angeles in California. Thank you everyone for doing your part, and thank you Jan for helping us taking our word out. Much appreciated. I would like to thank everyone at the hospital who's working very hard, and please stay safe, stay home, and God bless all of you.